Agreed to, and I call the member for Indi.
Deputy Speaker, thank you. I'm absolutely delighted to support this legislation and second the comments from the various speakers. However, in doing so, I'd like to say while it's a good first step, it doesn't go nearly far enough. And in addressing my comments to that, I'd like just to put into the context to acknowledge the Minister and his staff for the open way you've worked with this, and how I'm going to be moving some amendments a little bit later, but I acknowledge the great communication that we've had together, so thank you for that. I'd like to just stress that health is one of the fundamentally important aspects of our community, and in my electorate, together with transport, telecommunications and education, health is one of the most commonly addressed issues that I hear when I go around my community. So when we get legislation in front of us like this, you're really optimistic that the government have actually understood the complexity of health and how it's an integrated issue that we need to address. And sadly, it's not only about GPs. So in my comments today, I'd like just to talk about, in my electorate, how important an integrated approach to regional health is. And while doctors are really important, they're only one part of what is a system. So for many, many people, their place of health and health care is not the doctor. It might be their home. It's the parents, it's the mother, looking after the kids, teaching the children about hygiene and how to have exercise and how to be safe. So for me, the home and the parents are a fundamental place for health care. And once we've got the home looked after and we've educated our families and our parents well, the next sort of circle of influence around health is our schools. And I'm really pleased that in Victoria, the Victorian government is doing some fantastic work on trialling doctors in schools and working in that context. A great approach. And the next circle out from our schools is our communities. And in our communities, certainly in country areas, it's not only community health, but it's the other community workers that play a really important part. It's the aged care workers, it's the childcare workers, it's your local government workers, the health inspectors. What an important role they play in our health. And then we've got our workforce. And again, a really significant role that our OH&S and our workforce people play in keeping us safe at work. So within those contexts, we've also then got our hospitals, which is the most obvious place we go to when we think about health. You think about the emergency service at the hospital. And then, of course, we've got our GPs and our specialists. So if you can just imagine that as a system, everything needs to be in balance if we're going to actually do what needs to be done to improve the overall health of our community, because we've heard all the speakers today, and indeed the Minister, say how poorly our rural communities are doing with health. So while I welcome the support for GPs, it just makes me really sad that we've missed the opportunity to do so much more. And I acknowledge this was an election commitment, and it's important that we fulfil election commitments, but I really do feel it lacks ambition. So I'm looking forward to now working with the Minister and his advisers and saying, tick for this. Now let's have a go if we can see if we can get the whole system to work and do a much better job of improving health for rural people. So if I could now take the opportunity to talk a little bit about what happens in my electorate with health. And I want to just take a few minutes to call out to the many providers. Now, I've talked about the home and the families, and I've talked about community health. But what I really want to do today in this speech is to acknowledge the work of the institutions, because they are the focal point that really needs a lot of attention and a lot of help. And when we constantly talk about government, it's the institutions that we're looking to for funding to enable them to do their job. So I want to acknowledge Albury-Wodonga Health, a fantastic initiative, cross-border, Albury and Wodonga together. And I don't know if you could possibly imagine the impact it's had on our community, having Albury and Wodonga work together, the cross-border approach that we've now got, and the connectivity that happens because we've got one board, we've got everything working, the cancer centre, the babies, the emergency health, all working together. So a bit of a shout out to Albury-Wodonga Health and for the fantastic work you do there. And to link it to this legislation, because Albury-Wodonga Health doesn't only exist as sort of a hospital, it also does training. So Albury-Wodonga Health has a relationship with New South Wales Uni, and the doctors come from New South Wales to come and do their year rural work in Albury-Wodonga. And that's such an important aspect of the training, because it gives all those city-based, or other, not always city-based, but gone to the city for training, a chance to actually work in a rural community and get a sense of how wonderful it is to work into Albury-Wodonga. And to all the people who have done the work to make that training centre there work so well, I just really want to just say thank you, because I know all the staff there just go so far beyond their call of duty to make the experience for those doctors doing their training just such a rich one. And to all the doctors who come from other places to Albury-Wodonga to do that year's training, we love having you. We want to see more of you, clearly, but we really do hope that the experience is so rich and rewarding that you'll put your roots down and you'll come and live in our community. So that's Albury-Wodonga Health. In a similar way, in Wangaratta, we've got North East Health, Wangaratta. So that's the Wangaratta Hospital, again, that does a fantastic job in providing hospital and related services, but it also does doctor training as well. So through their relationship with the Department of Rural Health at the University of Melbourne, they do fantastic work getting the people from Melbourne University to come up and do their training in Wangaratta and get some just amazing exposure to really top quality medical specialists and ways of working. So a real shout out to Albury-Wodonga and to Wangaratta Health for the training you do for our doctors. And I'll be looking forward to working with the Commissioner to say, well, here's some models that are working really, really well. How can we replicate them in other areas and actually finesse them a little bit more where appropriate? But I just want to take the moment to talk about what happens in Wangaratta as just an amazing example of the creativity and the innovation that's coming out of our rural hospitals and the related training. So in Wangaratta we've got, they call it telehealth, but in fact what it is a provision through the internet and providing telecommunication video, high-quality video services that in some of the smaller hospitals we can link into Wangaratta, so that you might be in Corryong or you might be in Mansfield, and over the weekend you can actually link into the specialist services in Wangaratta via the internet and have your immediate diagnosis done, and if you need extra services, it's all there. And that has made such a difference to our smaller hospitals, and I'm just so pleased and want to really congratulate to Wang for taking that initiative, and what a fantastic job it is and what a service it provides to our communities. But of course it explains this system approach that I've been talking about. It works well because we've got a dedicated internet service. Now, the ideal would be that everywhere in Australia, and particularly rural Australia, we had access to quality internet services. Now, sadly, that's not the case, and even I'm not even hopeful that the NBN service will deliver the expertise we needed. But if we could have had it, and maybe if we do get it, it will just absolutely revolutionise the ability of our hospitals and our GPs and our medical professionals to provide services for people back into the other parts of the system, into the home, into the schools, into the workplaces and the other areas where health and healing is practiced. So in acknowledging those two major providers in my electorate, I also just want to do a call out for two other specialist health providers. So that's the Upper Murray Health and Community Service that works in Corryong and Walwa. They're a multi-purpose service. And I just want to take the moment in talking about this because the multi-purpose services are no longer popular. And it's such a pity because in our rural communities they provide health, aged care, they employ doctors. So in Corryong they employ doctors to come and do the health community work that we need doing. The model of funding hasn't changed in years, and we absolutely need to review that multi-purpose service funding and reintroduce a 21st century approach, because hospitals like Corryong provide such a service in my community. And if we can't get the funding right and they close, we'll have no doctors there, because the only doctors in Corryong are the multi-purpose employed ones. So if we don't have the MPS providing the service, that whole community will be bereft. And in a similar way, I'd like to acknowledge Alpine Health. Alpine Health is another MPS, and it works in Mount Beauty, Bright and Myrtleford. And that MPS is particularly noteworthy because of the health promotion work that it does. It provides that extension to the community, to the families, to the workplaces, to the community health, and does such a good job in actually keeping people out of hospitals and out of our GP services through its health promotion. And so one of the things that I'm really disappointed about in this legislation is we don't talk about health promotion. We haven't talked about how stopping people getting ill is a really, really important part of the whole role. So I'm just putting it out there that it's an area of work that I think we could do a huge amount of, the government could do a huge amount of work in, and it would save us so much money further down the line. So if I want to just say, health is a complicated system, and this bit of legislation only addresses a small part of it, a very important part, which is our doctors and our GPs. But we've got a lot more work to do to make sure that the system actually works better in rural and regional areas. So if I could just turn my thoughts to a moment to some of the problems that I see with this legislation and what I would like to see happen. One of the things the minister said in his second reading speech was that this was going to be an independent position. Now, sadly, I don't accept that if you put a person working in a health department that they'll be independent. I don't see how that's going to happen. I can't see the arm's length there that's going to be engaged. I can't see how this position is going to actually have the ability to consult widely. You could spend your whole 2 years just doing consultation. So that idea of an expert panel that this position can work to would be really important. At the moment, as the legislation stands, this position does not report to Parliament. Well, in fact, it does in a way. The legislation says that the Commissioner has to report every year on what they're doing, but the final report goes to the Minister. So it's my belief that the final report should come to Parliament. Now, I've got great respect for the current Minister for Health, this current Minister who's bringing this legislation to the Parliament, but sadly he might not be the Minister in 2 years' time. So we've just got to make sure that the report actually comes to Parliament and the Parliament gets a chance to know what the Commission is doing and are in fact doing what they've been set out to do. So my amendment set out to make the position more transparent by requiring the Minister to table the final report within 5 sitting days. It's to ensure that rural and regional communities are consulted by including them in the bill, rather than assuming that they'll be in the other stakeholder group. So I can't quite see how the family, the home, the schools are going to be consulted in this process, and it's really important that they are. And I also include in one of my amendments a role for the Commissioner to consider the affordability of health services, and particularly addressing the problem of no-gap bulk billing. And just to talk about bulk billing, it's such a problem in my community that we don't have doctors who bulk bill in many, many of my smaller rural communities. And the doctors say, well, we can't afford it on one hand, but they also say that we do it, and they do it as an act of grace if they see the need. But to me, you shouldn't be relying on the goodwill of a doctor to be bulk billed. It should be part and parcel of the function. And we need to do a lot of work on bulk billing to make sure it's more evenly addressed in rural and regional areas. So in bringing my notes to a close, and as I say, I will be further addressing this in the more detailed third reading, I'd like to acknowledge what the bill does. It's great that the election commitment is being addressed. I'd like to acknowledge the work of the Minister and his staffers and thank them for their cooperation. I'd like to ask for much greater ambition. I think we, as everybody said, we haven't got anywhere near resolving the problem. All we've done is picked up on one very small aspect of the problem in the system, and we need to do a significant amount of more work. And I would be very happy to work with the Minister to do that, and very, very keen that we come back to the House with other pieces of legislation that actually bring a systems approach to this particular issue. Thank you, Deputy Speaker.